I had some experience early on when I was in high school, actually volunteering at a hospital pharmacy. And so I got to see some of the pharmacists working there and I guess how they were able to affect patient outcomes. What I see, kind of as I mentioned earlier, that I really like about being a health system pharmacist is you're part of a larger multidisciplinary team when taking care of patients. I get to learn a lot from the physicians, I get to learn a lot from the nurses, and it's not just giving medications, but seeing how different IV infusions are run, how we can implement medication safety in some of those areas so the physicians better understand it. What I'm seeing now that is really exciting with pharmacy is getting to play a role in transitions of care for patients. So a lot of hospitals and healthcare systems are focusing on what they call like the continuum of care, where you're in the hospital setting and then when you're going into a longitudinal setting, clinics and so forth, getting pharmacy presence there and sort of showing how pharmacy can play a role in reducing readmission rates to emergency departments and getting to work for patients after they've left the hospital, which I think is an area that needs more pharmacy involvement. I love the concept of being a lifelong learner, and I think that's really embraced in academic medical centers. I think there's always time to pause and ask questions as to the why we're doing certain strategic initiatives for the hospital, and even on a clinical side, just working with physicians and getting to ask questions. I think for pharmacy students coming in, trying to get into an academic setting, it's more competitive now than it ever was. So I think getting an early start on figuring out what kind of road you want to go down, and just kind of getting the right experiences to get there. I'd like to personally get more involved with our school, the School of Pharmacy at the University of Colorado. And, I think in general, nursing programs have a lot of focus on empathy. And I don't see that so much in pharmacy school programs. And again, I think it goes back to thinking about your patients, less of, a list of variables and lab results and more actual people. I think there's still that aspect of meaningful human connection with our patients that I think needs to be a priority in the future of pharmacy to really excel.